Abdominal distension is a condition that happens when your belly appears larger or feels fuller than normal. Think of it as your abdomen swelling outward, becoming tight and uncomfortable. This isn't just about gaining weight. It's specifically when your belly expands beyond its normal size due to various underlying conditions. Many people describe it as feeling bloated, like their stomach is stretched or filled with air. The distension can range from mild discomfort that comes and goes to severe swelling that significantly impacts your daily life. Sometimes it develops slowly over days or weeks, while other times it can appear suddenly within hours. Unlike regular weight gain that occurs evenly throughout the body, abdominal distension specifically focuses on the midsection, making your belly protrude outward while other parts of your body remain unchanged. It's important to note here that abdominal distension isn't a disease itself, but a symptom of an underlying issue. Types of abdominal distension. Abdominal distension is usually categorized into functional distension and organic distension. Functional distension is the most common type, and it occurs when there's no structural abnormality, but your digestive system isn't working properly. This type of distension usually fluctuates throughout the day and can worsen after meals. Examples of these causes include gas or irritable bowel syndrome, IBS. Organic distension, on the other hand, occurs when there is a physical obstruction in the intestines that prevents the normal movement of food, gas, or fluids. This can be caused by conditions such as tumors, strictures, or adhesions from previous surgeries. Causes of abdominal distension. Abdominal distension can occur for many different reasons, and identifying the underlying cause is crucial for effective treatment. Excess gas production is one of the most common causes of abdominal distension. When bacteria in your intestines break down certain foods, they produce gas as a byproduct. Foods notorious for causing gas include beans, lentils, broccoli, cabbage, and whole grains. Some people also experience excess gas when consuming dairy products if they have lactose intolerance, or when eating foods containing certain sugars like fructose or artificial sweeteners. Constipation is another frequent cause, as when stool moves too slowly through your colon, it allows more time for bacteria to ferment its contents, leading to gas buildup. The backed up stool itself also takes up space in your abdomen, contributing to the swollen feeling and appearance. Other than that, digestive disorders such as irritable bowel syndrome, lactose intolerance, or celiac disease can also lead to bloating and distension by affecting how food is broken down and absorbed in the gut. But it's not always about digestion. Fluid accumulation within the abdominal cavity, known as ascites, represents a more serious cause of abdominal distension. The most common cause of ascites is liver cirrhosis, where your liver is damaged and can't produce enough albumin protein. This protein is essential for keeping fluid in your bloodstream, and without it, this fluid gets forced into your abdominal cavity, causing distension. Other than the liver, heart failure can also lead to ascites. When your heart cannot efficiently pump blood, the pressure in your blood vessels increases, forcing fluid to leak into the abdomen. In some cases, some gynecological conditions can cause abdominal distension in women. Ovarian cysts, uterine fibroids, endometriosis, and pelvic inflammatory disease can all contribute to a distended abdomen. Many women also experience cyclic distension related to hormonal changes during their menstrual cycle, particularly in the days leading up to menstruation. Finally, we have gastrointestinal obstruction, which represents a potentially life-threatening cause of abdominal distension. When something blocks your intestines, whether it's a tumor, scar tissue, hernia, or impacted stool, contents can't move forward properly. This leads to backup behind the obstruction, with fluid and gas accumulation causing sometimes dramatic distension. This type of distension typically comes with severe pain, vomiting, and inability to pass gas or stool. Symptoms of abdominal distension. The most obvious sign of abdominal distension is the visible enlargement of your belly. Your abdomen might look swollen, stretched, or unusually round compared to its normal appearance. You might notice your pants feeling tighter around the waist while fitting normally elsewhere. The sensation accompanying abdominal distension varies widely among individuals depending on the cause. Gas-related distension typically causes a feeling of fullness, pressure, or cramping that may move around the abdomen and temporarily improve after passing gas or having a bowel movement. In cases where fluid retention is the cause, the abdomen may feel firm, and the swelling might be more persistent and gradually increase over time. Obstruction pain tends to come in waves as the intestines contract against the blockage. Inflammatory conditions usually cause steady, localized pain that worsens with movement. The timing and progression of pain provides important diagnostic clues. Distension that worsens throughout the day and improves overnight suggests functional causes like IBS or slow transit constipation. Gradually increasing distension over weeks or months might indicate a growing mass or slowly accumulating ascites. Cyclic distension in women that correlates with menstrual cycles suggests a gynecological component. Finally, sudden, severe distension accompanied by pain and vomiting points toward acute obstruction requiring emergency care. Diagnosis of abdominal distension. Figuring out why your abdomen is swollen starts with a detailed chat with your doctor. They'll ask about your diet, bowel habits, medical history, and whether the distension comes and goes or is constant. A physical exam is next. They'll tap on your belly to check for tympany, which is a drum-like sound suggesting gas, or dullness, indicating fluid. Pressing on specific areas helps pinpoint tenderness or masses. If fluid is suspected, they might perform a fluid wave test. Lying on your back, the doctor taps one side of your abdomen while feeling for a wave of fluid on the other side. If necessary, imaging tests such as ultrasound, X-ray, or CT scan can be used to examine the internal structures of the abdomen and detect any blockages, tumors, or fluid accumulation. Blood tests may also be conducted to check for signs of infection, liver, or kidney function problems, or hormonal imbalances that could be contributing to the condition. In cases where digestive disorders are suspected, breath tests may be used to identify bacterial overgrowth or lactose intolerance. A colonoscopy or endoscopy might be recommended if there is a need to examine the intestines for inflammation, ulcers, or polyps. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for abdominal distension. The treatment here depends entirely on the cause, but here are the most common approaches. Number 1. Dietary modifications. For mild distension caused by gas or bloating, identifying and limiting foods that trigger symptoms can bring significant relief. Common culprits include beans, lentils, certain vegetables like broccoli and cabbage, carbonated beverages, and foods containing lactose, fructose, or artificial sweeteners. Following a low FODMAP diet, which restricts specific types of fermentable carbohydrates, has shown effectiveness for many people with IBS and functional distension. Number 2. Medications. If excessive gas is the problem, over-the-counter remedies such as simethicone can help break down gas bubbles in the intestines, making them easier to pass. Activated charcoal tablets can also absorb excess gas, though they should be taken separately from other medications as they may reduce absorption. For constipation-related distension, various laxatives work through different mechanisms to promote bowel movements. These include bulk-forming agents like psyllium, stool softeners like Docusit, osmotic laxatives like polyethylene glycol, and stimulant laxatives like bisacodyl for more severe cases. For individuals with digestive disorders like irritable bowel syndrome, medications such as antispasmodics or probiotics may be recommended to regulate gut function. If an infection is present, antibiotics may be necessary to clear the underlying cause. Finally, in cases of fluid retention due to liver or kidney disease, diuretics may be prescribed to help reduce excess fluid in the abdomen. Number 3. Lifestyle changes. Your eating habits matter tremendously here. You should try avoiding behaviors that introduce excess air into your system, such as chewing gum, drinking through straws, or eating too quickly. Regular physical activity also naturally stimulates your intestinal muscles, helping move gas through your digestive system more efficiently and preventing constipation-related distension. Even a short walk after meals can make a remarkable difference in reducing bloating. Managing stress plays an equally important role since your digestive system responds strongly to emotional states. Techniques like meditation, deep breathing, yoga, or progressive muscle relaxation can calm your nervous system and reduce abdominal distension, especially when related to functional disorders like IBS. Number 4. Paracentesis. For large or painful fluid buildup in ascites, a doctor may drain the fluid using a needle and catheter. This provides immediate relief, though fluid often returns unless the root cause, like liver disease, is managed. Number 5. Surgery. Surgery becomes necessary when abdominal distension results from conditions like bowel obstruction, large tumors, severe hernias, or complications of inflammatory bowel disease. The specific procedure depends entirely on the underlying cause, ranging from removing the obstructing element to resecting damaged portions of intestine. At the end, while mild cases of distension often resolve on their own with simple dietary and lifestyle adjustments, persistent or severe swelling should not be ignored. Now we want to hear from you. Have you ever experienced persistent abdominal distension? What triggers have you noticed, and what remedies have worked best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.